Hi, it's Dr. Sharon Stills, one of your physician experts here at Women's Health Network. Today we're going to talk about a topic that is a little sensitive because it's about how to improve your fertility naturally. And if you are a woman who's dealing with infertility, I understand and empathize that it can just be heartbreaking. To me, infertility is right up there when we're talking about stress with death and divorce and loss of job. It's just a really, really challenging thing to go through. And I just recently had a patient who was having a really hard time getting pregnant, was struggling for years. And after just a couple of months of working together, going through the tips that I'm about to share with you, I'm happy to report that she was able to conceive. And so if it can happen for her, then the possibility that it can happen for you as well certainly exists. So sit back, take this in if it applies to you personally, or if you know someone in your life who's dealing with this issue, be sure to share this video with them as well, as it can be a life changer. So infertility is obviously when you have difficulty getting pregnant, and we need to really try to get pregnant at least a good 6 months before we start to think something is wrong. So if you've only been trying for a month or two, before you start going crazy or seeking infertility treatments, just give it another few months and see. Sometimes it takes a little while for you to conceive. What I'd like to talk about is 8 causes of infertility and what you can do about it naturally. I really am a big fan of treating infertility naturally because the medications and the hormones that they use when you go see an infertility specialist are really harsh and can be quite damaging to the body and can have after effects that can disrupt your health even after you've conceived a baby. So always better to start with the least invasive methods, and the things that I have to share with you are all natural. They're all only going to help improve your health. So let's start. Tip number 1 has to just do with stress and your adrenal function. If you are stressed out, the body is going to not be concerned with reproducing. The body is going to be concerned with helping you to fight the proverbial saber-toothed tiger that you're stressing out over. So really important to check your adrenal function, which I recommend doing with your natural healthcare provider, naturopathic doctor, or functional medicine practitioner, and doing a 4-point saliva test so that you can really see the bioavailable cortisol, which is your stress hormone, and you can see it through the rhythm, the diurnal rhythm, because just seeing one sample of cortisol in a morning blood sample doesn't tell the whole story. We want to know what's going on throughout the day, and if you're low in the morning, you may be high in the evening, and there's totally different treatments for the different responses. So please look for a 4-point cortisol in the saliva. In addition, if your adrenals are wired and tired, doing things to relax. Breathing is just the first place to start. Our breath is the best medicine for you, and it's always with you, and it's free. So simply breathing in through your nose and out through your nose can really just help reduce stress. And just trying your best, and I know it's easier to say than do, but doing your best to really just let it go and just enjoy having intercourse with your partner, knowing that you want to get pregnant, but not making it a job. Sometimes the fact that we're just trying to get pregnant so hard, it takes away the beauty and the intimacy of intercourse. It becomes like a job we have to clock into. Okay, am I ovulating? Let's get it on and do it. So just really doing your best to relax, to breathe, to pamper yourself, to smell some lavender, to get in your garden, whatever it is that you know, a bubble bath, a good book, a massage, whatever it is that's going to help you to relax. Tip number 2 has to do with toxicity in the body. Over where I study in Europe a lot, they did a big study and they showed the number 1 cause of infertility was heavy metal toxicity. And so if you're holding on to mercury or lead or arsenic or cadmium, if you have these toxic metals stored in your fat tissues, that can be blocking you from getting pregnant. And so what I like to do is if I get a patient who knows they want to be pregnant, I like to do all these tests even before they start trying. Because another thing is if you are pregnant, and I know this from experience because unfortunately I didn't know this when I was pregnant many, many years ago with my kids, but I was carrying a mercury load. And what happens is when you're pregnant, if you haven't gotten rid of that mercury load, well, your baby becomes this amazing chelator and you get rid of your mercury, but you pass it on to your child. And here I'm telling you this so you don't have to be in the position that I was in. And so heavy metal testing is best done in the urine, a pre and a provoked challenge. What that means is you do a urine sample, just a regular urine sample. Then you take a chelating agent and then you collect your urine for another 6 hours to see what's stored in your fat tissue, because it's stored very tightly in there and we have to encourage it or provoke it to come out. Tip number 3, emotional and spiritual beliefs. And so I touched a little bit about the stress when we talked in tip number 1 about the adrenals, but really just checking in. Do you have any fears? Sometimes we say we want to get pregnant, but maybe deep down we had a traumatic childhood and we're afraid we're not going to be good parents, or we're scared to become a mother. And so working with a spiritual counselor or therapist, but just to clear out and make sure there's nothing blocking you. And a lot of what blocks us is subconscious. And so you may say, no, I'm ready. I'm not scared. But if you're having difficulty, it's worth bringing someone onto your team who can help just probe a little deeper and make sure that you're not blocking it from an emotional perspective. Tip number 4 is a biggie. It has to do with your thyroid function. I can't tell you how many women I have helped get pregnant by just fixing their thyroid hormone. And they had been to infertility specialists, they've been to the endocrinologist, they've been to their primary care, and they were told your thyroid is fine. And if the thyroid isn't functioning, we don't produce enough progesterone, and progestation. We need progesterone to maintain a pregnancy. And so this is a huge one. So make sure you have your TSH run, your free T3, your free T4, your anti-TPO, your thyroid antiglobulin levels, your reverse T3, and make sure you're working with a physician who understands thyroid and doesn't just treat numbers and lab results, but actually treats you. Number 5, hormonal imbalances. So I just mentioned progesterone. And so this is a biggie, obviously. We need our sex hormones, and we need ovulation, and we need the right balance of estrogen and progesterone to actually be able to conceive. And so testing your hormones, the best way to do that is through a 24-hour urine panel. And so again, you're going to need to work with a healthcare practitioner, such like someone like myself, a naturopathic doctor, a functional medicine doctor. A typical medical doctor, obstetrician, or infertility specialist are not going to do things the way that I'm telling you to do it. And that's where you can be misled and you go down the path of very expensive hormones that are synthetic. So when I do help patients get pregnant and they do have hormone imbalances and they need them replaced, I'm always using bioidentical hormones, which are identical, biologically identical to what your body produces. So the side effects are not at all the side effects that you take from synthetic pharmaceuticals are multiple and dangerous. And I rarely, if ever, have seen any side effects from the bioidentical hormones when they are administered properly and monitored through the 24-hour urine. Tip number 6 has to do with nutrition. If you are not feeding your body whole nutrients and you're existing on like a sugar and carbohydrate diet, your body is just going to think, you can't even take care of me. You're not going to be able to take care and feed and sustain a baby. And so it's really important that you get your food sensitivities out of your diet, that you're feeding yourself properly, that you're getting the proper macronutrients and your protein and your carbs in healthy forms from vegetables and whole grains, that you're getting healthy fats such as avocado and salmon and mackerel and olive oils and good nuts. So working with someone who can really get a look at your nutrition, getting the fast food out of your diet. Hopefully you're not drinking soda or diet soda, but if you are, it's gotta go. Getting properly hydrated, making sure you're drinking pure water. All these things are super, super important. Tip number 7 has to do with sleep and exercise. So it's important that we are in a healthy physical condition. So if you are not getting your 8 hours of sleep a night, not only is that going to exhaust and fatigue your body, it's also going to mess with your hormones, because the hormones rebalance in their circadian rhythms that go on when we sleep at the appropriate time from about 10:30 to 6:30. And exercising to reduce stress, to have a healthy body weight, to increase circulation and lymphatic flow, all of these things that can contribute to infertility. And tip number 8 doesn't have to do with you, but it has to do with your partner. So often when there's an infertility issue, we're so quick to look at the woman, and sometimes we forget about the guy. So if you're having problems when you start to go through your workup, have your honey go through his workup too, and make sure that his sperm are mobile and that he has enough nutrients, that he's producing sperm and it's viable sperm. So really, really important. I'd hate to see you go through a huge workup and stress, and then finally they get to your guy and it was like, oh, it was him all along. So I really hope this was helpful. Please like this video, share it with people in your network, especially those women who are struggling. And please subscribe to the Women's Network channel on YouTube, where we'll be sharing a lot more informative videos that hopefully will help you to be a healthier you. So I'll see you soon. I'm Dr. Stills, and it's been my honor.